individuals, all individuals, respond based on how they respond to trauma. So it's going to be different for any two people or any three people. Some people live with trauma every day and do just fine. Other people live with trauma, and then there's one particular trauma that just sends them over the edge. Then there are other people who don't have necessarily a lot of overt trauma, but aren't able to handle any trauma per se at all, and would have a great deal of difficulty. So it's an individual equation. Different people respond very differently to trauma, although we all, again, have trauma. And stress is in all trauma. So a lot of this is how do we respond to stress, and then how do we manage and how do we cope beyond that. Trauma is a stressful event, often associated with a circumstance or a particular event. And it can be psychological, it can be emotional, it can also be physical, and usually sufficient to overwhelm an individual's ability to cope. When you're talking adolescence, again, you're talking about a time of significant change, and a number of things could be occurring. Their parents, person's parents may have divorced. A parent may have lost a job. There may have been significant changes in the household. The young person might be bullied, especially coming to a new school and not knowing the lay of the land. May have just lost a relationship that was important to them. So may have some type of medical problem going on. You don't know. So the idea is that we are always seekers of information, or should always be seekers of information, to understand how best to support this young person through a difficult time. There is such a thing that's called trauma-informed education. And a lot of that focus is not just on the individual, the adolescent, the student who's going through trauma, but a lot of that is on the response of the teacher or counselor or others who interact with this individual. For example, if this individual is having difficulty getting along with peers, then the question might not be, what's your problem, or why did you do that? It may instead be, so what happened? You know, what contributed to this? In a very more accommodating way, a more understanding way. That's from the teacher or from the counselor. Whenever a teacher encounters an individual that has difficulty that may be related to triggering or to the trauma, then there are a lot of other questions that should be asked. Explored. For example, you know, what happened around the event that you think is related? Is there anything else going on in your life that would be helpful for us to know about? You know, how can we support you? How can we help you? Have you gone through something similar before? What was successful for you? Have you gotten through on your own? And should we just back off and leave it to you to do what you're doing? You know you're really doing a good job, and sometimes the things that you're dealing with are beyond understanding, even for me. But I'm here to support you if you need that. So a much more supportive, accommodating approach would be most helpful for teachers and for others who interact with this person. Well, there are cultural differences, of course, and racial differences. There are class differences. For example, if you think about cultural differences, there are individuals who live in inner city poor neighborhoods, oftentimes mostly Black or Latino, and they deal with trauma every day. You can look at the statistics and see how significant percentages of these individuals have witnessed trauma, have witnessed people being shot, have witnessed people being hurt, have witnessed families breaking up, have witnessed conflict within the community, have witnessed abuse, just down the line. So I think that understanding that background and how, unfortunately, for a number of children who come into the system and come into contact with teachers and others, that they are very fearful and full of anxiety and worry. So that's going to cause them to pretty much cover up. It's just a neural reaction for many of the kids that they want to be protected. So if they push back or if they say some things that might not be comfortable for the teacher or for adults, sometimes you have to roll with it. Sometimes you have to accept that and to be able to work with them to understand that it's not personal, that it's not in the moment. It's trying to understand the context to help them work through the context. Another might be immigrant children, because you are going to want to understand the circumstances that they came to this city, to this nation under, and what they fled to come here, if they fled anything, and how they are responding to what they see to be a very unfamiliar culture, a very unfamiliar set of ways of doing things, and to understand that their reactions, again, are going to be personal, but just trying to make sense of all of this in the midst of the tremendous change that adolescents are going through at any time as well. I would think around the racial aspect that anyone dealing with trauma is going to, again, with the differences, would have to certainly respond to the same set of stresses and to work through in the same way. It's just that in many cases we see increases in trauma, but increases in suicide and diagnosis of depression and anxiety and other aspects among some groups, especially, again, the groups of color who are in communities of color. But the way that I would label would be survivor, overcomer, extraordinary. Because if you begin to think about the circumstances that many of these individuals come through, very few people can get through those situations unscathed, but yet they make it through. A vast majority of them. So it's important that we get behind them, to not talk about them in pathological terms, to not feel sorry for them, but to understand that they have strengths and to identify those strengths and to support those strengths. And I think that that's a part of trauma-informed education, but that's also a part of just being human. And I think of myself in that situation. I think that's what I would want people to understand about me. So you can leave the negative labels aside, because that's not what I'm about. I'm just about positivity and getting through. And the vast majority of the individuals that come through those circumstances, that's what you're going to meet when you meet them. When you work with young people, remember that if you could put yourself in their position as well as you could, and to understand that it's what they bring, but it's also what you bring and what you meet in the middle that will really make a difference, can really make a difference in their life. It's important to see the interaction with the young person as maybe the last best chance that individual has to be able to get some help. So if you as an educator adopt that understanding and that approach, I think it would put you in a much better position to be able to be much more effective and beneficial for the young people you're working with.
Hi, my name's Skylar and I'm 15 years old. My mom and I had to relocate to Massachusetts when our house was destroyed in Hurricane Sandy. It just kept raining and raining, and the wind was blowing so loud I had to cover my ears. We had to stay to shelter for a couple of days. So now I live with my grandmother in Massachusetts, but I miss my old school.
Hey Skylar, what's up?
Nothing much.
Did you get a new phone?
Yeah, I was at the Apple store earlier.
Whoa, is that a new 6?
What?
An iPhone 6.
It's raining out. Can you hear it? I don't think I can stay in here. I need to go to the office and call my mom. I need to know she's okay.
Okay.
I just keep remembering what happened before, when my house was flooded. I just need to talk to her.
It's an individual equation. Different people respond very differently to trauma, although we all, again, have trauma. And stress is in all trauma. So a lot of this is how do we respond to stress. And then how do we manage and how do we cope beyond that?
You know, I hate that anytime it rains I freak out. I just can't help but think of Hurricane Sandy. But at least my friends didn't run away today, and the teachers here tried to help and asked me why I was afraid. I don't think there'll ever be a time when I'm not afraid of rain, but maybe it won't be so bad. At least they seem to care.
It's important to see the interaction with the young person as maybe the last best chance that individual has to be able to get some help. So if you as an educator adopt that understanding and that approach, I think it would put you in a much better position to be able to be much more effective and beneficial for the young people you're working with.